and also talk about these new strains of COVID-19 that not only appear to be more contagious, but there's reports now that they also may be more deadly. In some ways, the vaccine is this light at the end of the tunnel, but we're still in the tunnel. We're far from that light. I worry that we're not acting that way, that we're rushing to get back to life as it was before. Restaurants are about to open next week, and they're sending back kids to school in person. For African Americans, I keep saying this is especially dangerous. We can't afford another spring and summer like we had last year. Carrie, I'm going to start with you.
That was the topic of this morning's show. And I was surprised to find out that as many African Americans really, they are ready. They just want more information on the vaccines. They will take the vaccine if, in fact, they are provided with, they want their questions answered. The truth is African Americans simply want to make sure that we're receiving the same quality health care that everybody else is receiving. And if we are, they are going to roll their sleeves up and take the shot when it's their turn, just like everyone else. They just need their questions answered. And I think that, the medical community, especially the African Americans in the medical community, are doing a great job of trying to push that information out to the Black community to say, don't believe the hype, don't go conspiracy theorists, go get the shot when it's your turn. But you're right. The fact that, now that Biden is in office, everybody is saying, oh, Trump's gone. We can open everything now and everybody go back to living your life. No, we can't. It's still time to still wear your mask, hide out in the basement, actually wear 2 masks, still stay at home and stay away from people because we're not anywhere near. I mean, President Biden said himself, we've passed 400,000. We're heading for 600,000 before we get to the point where we're turning to where we get to the end of the tunnel. And folks need to realize that before they start running back out in the street thinking that, it's time now. We can go back to living a normal life.
Yeah, Greg, Bowen?
The communication and messaging around the vaccine and how it impacts the Black community, I think is still messed up. Sad to say. You just referred to us getting to the light at the end of the tunnel. And the truth of the matter is that even at 95% effectiveness, that means that 5% will still get sick and potentially die. Excuse me. The other thing is that the messaging is confusing because people are saying if you get the shot, then you don't have to wear the mask. Well, we know that's not true. So as opposed to getting to the end of the tunnel, I think we really need to say that this is another step in being able to keep you safe. We need to really refine that message a little more. The other thing is that the way that you sell stuff and all this stuff, I mean, I was like waiting on Kamala Harris, to the vice president, to get her shot. I was like, okay, she gets her shot, then okay, I'm good. I'll go get my shot. But the truth is that we're seeing people being slick about it and jumping the line and finding ways to get their shot early. Some guy who was an EMS guy in Florida just got arrested for stealing the vaccine and all this stuff. And so the shenanigans are out there. And if the shenanigans are out there, and Black folks, we know that we live in a society where the healthcare system is not the fairest to us,
right?
Then the concern, I bet, is going to get pretty quickly to where we really fall on that list of getting the shot. I know some people, even one on this panel who's not getting the shot is an anti-vaxxer.
Who's not getting
so I'll let you peruse the panel.
I had some doctors on my show the other day who talked about the fact that, we're really looking at the culprits here. The media has completely done a hit job on this issue around information and promoting misinformation. And unfortunately, there is money to be made, whether it's misinforming people around the issues around the vaccine or getting the vaccine, or not informing people. And so I think one of the challenges is that this is really where in 2021, we've got to really depend on not only science, but really the health professionals should be leading this conversation, not elected officials and politicians. Because, and I'll go back to something even Greg said, the politics has swayed people from either getting a shot or not getting a shot. And I think right now we've got thousands of people who, if they are recovering from COVID-19 or just trying to assure that they don't actually contract the virus. The other thing is looking at the economic impacts from COVID-19 and how we're going to deal with that in terms of getting those restaurant owners, getting them back up to snuff. 25% right now, that's not sustainable, Steve.
Sure. Karen, are you the culprit here? Are you not getting the vaccination?
Hey, I'm not the culprit, but let me say this. We are a country that has to be reminded that we have to wash our hands after we use the bathroom. I mean, so, we've got a long way to go in terms of a level of health consciousness. We're a dirty country. People think that their germs are okay. We need a comprehensive strategy. That's not going to happen because you're going to have people on both sides, and we are a country that respects a difference of opinion and free will. I don't encourage anybody to do anything that I do or don't do. I encourage you to do and find out as much for yourself and make a decision in your best interest. For me, no, I'm not. And I got dragged on Twitter because I said I wasn't going to do it. But, I'm friends with people who have gotten it. I'm going to be friends with people who don't. But I think we do.
Tell me
I'm
what
sorry.
your reason is. Tell me what your reason is.
I don't take the flu vaccine. I haven't gotten the flu vaccine. So
it's not killing half a million.
Are you wishing bad on me, Stephen? I'm just saying no.
No, I'm saying this is different than the flu.
And that's fine. But at this point, I'm not comfortable getting it. We've got 2 vaccines. They require 2 completely different levels of handling and distribution. Nobody's talked about what the ingredients are, but they tell you don't take it if you're allergic to it. The distribution, there are too many questions. The trial, usually in the beginning, they said we need 3 to 7 years to have an effective trial. That was accelerated into 3 or 4 months. It's just not something I'm comfortable with at this point. And so, I'm just going to have to talk to Greg over the phone. We are going to be in the same room.
Oh, Karen, I love you. You need to get that shot, darling.
In 6 months, no one's going to want to see you.
And that's something I'm comfortable with right now. I'm just not. So,
Sounds like
don't.
she has, as I said, there are a lot of folks that have questions, and every question that Karen said is something that I had someone on the show the other day that they can answer those questions.
I don't, but I've listened, but just like this, I heard Dr. Fauci in 2 different conversations. In one hand, he was encouraging people to get it, but then turned around and said, we don't know the impact of it in terms of prevention, in terms of transmission, or in terms of recurrence. So yeah, it's just, no, I just not right now. And,
obviously I reached a different conclusion for myself, and I hope that for most people we reached a different conclusion. But I respect the fact that you looked at the facts for yourself and decided something different. But as your friend, I say I want you to get that shot. I want you to come to the conclusion that it's the right thing to do.
Somebody got mad at me. They said you shouldn't say that. People listen to you, and you're encouraging them not to get the shot. I'm not encouraging anybody to not do anything. I am encouraging people to do what's best for them and what they're comfortable with. I'm not telling you not to get it. I'm not telling you to get it. I'm telling you to do what's best for you and your family, wherever you find that comfort.